Hi, so we're here with Ken, who just had Lanap surgery last week. How are you feeling, Ken?
Really good, wonderful.
Yeah. So you mentioned that your dad had some gum disease when he was younger. Tell me a little bit about that.
Well, I really didn't know so much about it. It was at an early age, and he was very secretive about his tooth decay and his gum disease. But he had all his teeth pulled at a very relatively early age of 35, and then he had really custom-made dentures, and so he was very private about that, and we rarely see him take them out his teeth.
And you first learned that you had gum disease when you went in and your dentist gave you a probing. Tell me about that.
Well, it seems kind of strange probing because I didn't have any bleeding or my gums weren't sore, but they started poking around in there and they started calling numbers off, and I heard some really large numbers, and I don't know, it just always seems like they always want to get you to spring for the next higher uptick or upsell you on more dental procedures. So I didn't like what I heard when they said you had to have deep cleaning.
So instead, your doctor told you about the Lanap protocol and that it was a treatment alternative for you. You opted to have Lanap gum surgery.
Yes.
That was how long ago?
About a week ago, last week.
Last week. How are you feeling?
Feeling great.
So how was the surgery? Was it messy? Were you in pain?
Not so much pain, but a little bit uncomfortableness. I mean, it was a dental procedure. People are in your mouth, and there's things going in and out, and it was kind of a lengthy procedure because it was a demonstration for the other periodontist, so no pain.
Okay, how'd you feel the next day?
There's no pain whatsoever as far as my jaw was concerned, or my teeth, or my gums. There wasn't anything aching. My eyes weren't blackened like some of my procedures I had with dentists. And what was so significant was there's no blood. No blood at all.
So no blood, really no pain, woke up the next morning and you were kind of back to normal.
Yep, pretty much back to normal, except I couldn't brush on the right side where they had done the procedure. It was a little bit delicate, but it didn't feel delicate. I was almost tempted to brush. They warned me not to brush for 10 days, but it just looked like it was very normal, but I paid attention and I followed the rules, so I didn't brush on the right side where the Lanap procedure was at.
Perfect. What advice, or do you have any advice for someone who has gum disease and is thinking about Lanap? What would you tell them about the surgery?
I would tell them perhaps for the first time in your life, adult life, you may have pristine gums, and there is no other way that I know of other than the archaic way of cutting your gums and sewing it up to get this type of procedure. So I would recommend it to anyone who has gum disease to take advantage and do the Lanap procedure. It's just, very pain-free, it's very efficient, and it's very quick, I would think, and so I would recommend it to anyone.
Fantastic. Well, thanks so much, Ken.
Okay, my pleasure.